My main clinical interest here at UF Health is pediatric trauma and pediatric burn care. I am the medical director of the pediatric trauma and burn program. I like newborn surgery. I like taking care of the neonates, the newborns, especially with some of the congenital issues and problems. Well, when I was probably like 4 or 5, I probably wanted to be anything that involved a truck or a tractor or something big. And then somewhere along the lines, I wanted to be a scientist. And I was pretty adamant about being a scientist for many years until probably about 7th grade. I think at that point I decided that I wanted to be a doctor. But to me, being a doctor meant being a surgeon. It was really kind of an epiphany moment. I had an opportunity to go and volunteer at a children's hospital. And within about 3 days of being in the children's hospital, the child was born with a congenital condition called omphalocele. I suddenly saw the surgeons show up and take care of this child. And I didn't realize that there were surgeons out there who dedicated their entire life and career to caring for children. And I think it was the environment that we were in where you had this hospital that was built for children. And from that moment on, I was going to be a pediatric surgeon. That was just, and I can actually give you probably the month and the year. Was July 1993. That's how, what a prominent moment, aha moment that it was. I always try to put myself in their shoes. So if I'm giving a family advice, I try to put myself in their position. I always try to treat the children that I take care of like they're my own, and try to, say, what would I want for my own child? What would I want for my own family member? Once you put yourself in that position, then I think the decisions become a lot easier. And I think it also builds trust with people, because sometimes there's no right answer. And sometimes you're kind of left to make very difficult decisions with not a lot of data and not a lot of evidence to kind of guide that decision. And so you have to make these decisions that are sometimes life or death. And sometimes they're mundane. But if you put yourself in the position of your patient and their families, then I think it makes the decision-making process much more equal. Personally, I'm very proud of my family. I'm very proud to have a very supportive wife who understands what I do and supports that, and I couldn't do what I do without her. And then I'm very proud of my 2 children. It's a real blessing to have them. And professionally, I don't think it's one thing. I think it's really being a part of a great team. I feel like my division of pediatric surgery here at UF Health is a great team, and it's always an honor and a privilege to get to be on a great team.